Hi, this is Isabel Liang with DC HealthLink. In this tutorial, I'll be demonstrating the application process in the individual and family marketplace. First, I'll go through creating a consumer account and linking that account to a broker's account. And then I will go through submitting an application for a consumer as well as selecting a plan. Consumer account, first you go to dchealthlink.com, you go to login at the top right. On create account, account is for individual or family. Select that in whereas. To enter the consumer's information. The path must be 8 to 20 characters. Contain the username, the first or last name of the account holder. Have one uppercase, one lowercase, one number, and a special character such as pound or exclamation. This is a security challenge. You type in the number that is in the image. If you want to read the number in the image, you can click on this double arrow icon to get an image that you can read. Once you have the account, you must log back in. Here you will select 3 security questions to answer. Most of these questions are to be able to reset your own password if you've forgotten your password. In the consumer's account, the consumer can select to work with a trained expert such as an assistant or a broker. And to do that, the consumer can click on Select the trained expert assisting you at the top right. They must have the number of the trained expert that they want to work with. This number pulls up this broker and the broker's address. Here, the consumer is going to allow the broker to submit an application on his behalf by clicking on Confirm. Now I will log out of the consumer's account. Log in as the broker. as a broker, click on Broker Login, for your username and login. Once you're into your broker's account, you will see your client request roster. You can see Mary Minor with the consumer account that I had just created. Assist client, you would want Assist Client, and here is the option of submitting an application for financial assistance, an application without financial assistance, browse the cost of health plans without submitting an application, and here you will have to enter the client's date of birth in order to view the premium ratings for those plans for that client. And this is to apply for an employer-sponsored health plan if the client is an employee and their employer is participating in DC HealthLink. I log out of the broker's account, go through a demonstration of submitting an application for an individual consumer. We'll go through an application for financial assistance for single childless adults. We'll click on I'm applying for myself and for my family. This is even if you are a broker or an assister applying on behalf of the client. You will select for myself and or my family. This is Privacy Act statement. Or you can choose to enter your phone number and an email address where we can send you notifications from DC HealthLink. Because this is an application for financial assistance, for the question, do you want to find out if you can get Medicaid or help paying for health coverage? You will select yes. Those who are not U.S. citizens or are a natural citizens, you will be prompted for additional information. In this scenario, the person is a U.S. citizen and is not a naturalized citizen, so we can move on to the next page. Here, the consumer has to answer ID proofing questions. The baseline information from federal data sources such as IRS or Homeland Security. Questions including prime address, mortgage, loan, and credit history. The consumer is able to answer correctly all of the ID proofing questions. The consumer can proceed with the application. If you will get a message on the screen, ask to call the administrator with reference number. Once you get a phone call to the administrator, by your identification over the phone, you'll be able to resume your application. In this case, the answers were correct, and therefore the applicant can proceed to the pages of the application. This is a childless single adult, and therefore we'll select there is no one else in the application group. For families, you can select yes and add other family members. Here, it asks if Michael, the consumer, will be filing taxes in 2014. Cannot be claimed as a dependent on anyone else's tax return. Therefore, I would select no. Here, view date of birth, social security number, and other information entered for Michael. Here we'll enter information about income estimated for 2014. Here it asks if Michael has any other adjustments to income that will impact his eligibility for financial assistance. And these adjustments are listed in the tax return form 1040A from line 23 to 25. Based on 2,500 pages entered in the previous page, my estimated income for 2014 is $30,000. Is not incarcerated, not participating in a health plan for 2014 other than DC HealthLink enrolled in a sponsor plan for 2014, click Next. The questions are related to Medicaid eligibility. Questions are whether anybody in the application group is blind, disabled, or need help with activities of daily living. I'm viewing that the information for Michael is entered. Click Next. Here you are submitting an application on behalf of your client and your broker. You can click on this menu and select Yes. You are prompted to enter a 9-digit TPA number. Application, there was certain information entered in the application that could not be verified, such as residency, citizenship. You can select verification requirements and timelines when you have to submit documents for application case. Here you will sign Michael's electronic signature to complete application. Here you're given the reference number for the application. You will want to jot this down so that if you need to follow up with DC HealthLink on the application, you'll be asked for the reference number. App has been submitted. Once you click on Show Eligibility Results, you will see what help Michael is eligible for. Here is Michael is eligible to purchase health insurance through DC HealthLink. Prior pages, there were verification documents required from Michael. Since Michael is eligible to purchase part of the health insurance, 90 days to submit those verification documents. If Michael had been eligible for Medicaid, he may have had to submit documents immediately in order for Medicaid coverage to begin. Here into plan shopping for Michael. You can select different metal levels that you're interested in. You can also select the deductibles, maximum deductible amounts that Michael is looking for. Click on View Plans. You can see all the plans that are listed here. And click on View Plan Details for the summary of benefits and coverage. This will provide the deductible, co-pays, and any other cost-sharing requirements for a member of this plan. If Michael is interested in knowing whether his current doctors are participating in this plan, he can check this provider directory here for this particular plan. So Michael would like to enroll in this particular plan, you will click on Select this plan. Confirm that you want to enroll in this plan by clicking on Enroll. Here, you will be provided a summary of the policy. There is only one person on this policy with no dependents, and this is the monthly premium for Michael. Coverage start and stop date. This is information that was entered on Michael's application. And this is the terms and conditions, which is the last page of the plan selection process. Michael will enter his electronic signature again to confirm his plan selection. Here, you will not click on Save and Exit. If you're sure that you will like to select this plan, you will click on Go to Payments. Once you go to Payments, you'll see a payment screen that you receive an invoice from the carrier that you selected. In this scenario, Michael had chosen a plan from First, and therefore he will receive an invoice typically in 3 to 5 days from CareFirst, instructions on payment. And he can log out of his account. If he logs back in, he can see his enrollment under enrollments, and then the enrollments folder, account. Any questions or sees any discrepancies in his account, he should contact DC Link. If he has any questions about his accounts at 855-532-5465. Also, additional information about the individual and family market at dchealthlink.com. Thank you.